This is Digital Pathology Today. Now, here's your host, Dr. Joseph Anderson.
Our guest today is Sam Terese, President and CEO of Alverno Laboratories. Welcome to Digital Pathology Today. I'm Joe Anderson. Sam Terese is President and CEO of Alverno Laboratories, an integrated laboratory delivery network serving multiple healthcare systems and hospitals in the Chicagoland and Indiana area. Sam Terese has more than 30 years of experience in the laboratory environment, including settings as varied as community hospitals, academic medical centers, as well as research-based organizations. Alverno, under Sam's leadership, has pursued a strategy of growth and consolidation and offers laboratory medicine, anatomic pathology services, as well as molecular diagnostics. Today we're going to be talking about considerations in going digital. What are the advantages to a healthcare system? What are the opportunities for improving efficiencies and consolidation through digital pathology? What does it mean to be an early adopter? Alverno clearly was an early adopter in taking its anatomic pathology services digital. How can it enhance the care that pathologists provide to doctors, patients, and healthcare systems? And what are some considerations in establishing a relationship in a digital pathology platform provider? Because clearly, as we're going to learn, it's not a one-off transaction or a one-time thing, but really it's an ongoing relationship or even a foundation upon which we can build.
This episode of Digital Pathology Today has been brought to you in part by JAV Advisors. With over 16 years' experience, JAV Advisors focuses on business and management consulting for digital pathology and artificial intelligence in deployment within histology, pathology, and cytology laboratories throughout the world. Call 213-258-6268 for more information. JAV Advisors.
Sam Terese, welcome to the podcast.
Well, Joe, thanks for having me. Really thrilled to be part of this discussion.
Yeah, so we're in very exciting times now. We have a lot going on in the lab space. I think certainly COVID has been a major disruptor in terms of volumes in the clinical labs, but also huge changes in AP as well. And so we're going to be talking here about digital pathology. So tell us a little bit about yourself, your interests and experiences in the lab space.
Sure. So currently today, I serve as the CEO and president of Alverno Laboratories, and I've been blessed to be around laboratories for 40 some odd years. So I've been through probably every laboratory experience you can think of, from small community hospitals to major academic centers. Diverted course and spent a decade on the pure research side in academia. So the interesting story about laboratory, I guess when I look back at it, I my first job while I was going to school was a phlebotomist. I don't know that I have any of those skills left, but like I said, it's been a great career, and you're absolutely right. We're in a really exciting time with digital pathology, and I do kind of chuckle every now and then, and sometimes you get asked this brand new creative idea, and when I reflect back to my research days, which were probably about 30 years ago, we were talking about scanning slides, mostly from a research perspective, to build libraries and research files. Unfortunately, in those days, we didn't have the optics to pull it off, nor did we have the memory to pull it off. As you might imagine, doing things on floppy drives probably doesn't work in the digital pathology space, but it has been around for a while, and it's really exciting to kind of see the IT side of the world catch up with it, and along with the optics. So really exciting time to bring that forward. It just took a few years.
Absolutely. It has been with us a long time, and it's interesting to see, these massive advances in technology and then other philosophical things such as Moore's Law and things like that, technology growing exponentially and the price going to zero. You mentioned those big files, it's terabytes upon terabytes of data, and even just the cost to store it used to be prohibitive, but now things are plummeting and things are becoming more practical.
Yeah, it's really kind of interesting, and Like I said, I go back to the days of floppy drives, and I kind of chuckle as I sit and, we're doing some, things in the house, and we have some images, and it's like, oh, I just went and bought a terabyte hard drive for pennies, it seems like, and I had to learn new terms like petabytes, and as we moved into the digital space. So, yeah, it's just an exciting time to see it, and for us at Alverno, it's really key technology.
Absolutely. So tell us, yeah, so you're particularly in a key position, with your experience in the business, but then also now as an executive and CEO at Alverno. So tell us maybe a little bit about the history of Alverno and how that has evolved.
Sure. I mean, Alverno is, by most definitions, a pretty young organization. I think we just celebrated 20 years of existence last year or the year before. So we're pretty young. We are kind of a different flavor of laboratory. We are really a laboratory integrator along with hopefully a technology innovator. So when I kind of look back over the last couple of decades, we started with integrating 6 hospital laboratories into a large central complex that we have outside of Chicago. And over the last couple of decades, we've gone from the original 6 to now 36. So we basically own and operate 36 hospital laboratories, and we move all of that work across several hundred miles of geography into our large central operation. And by doing that, yes, our hospitals function as rapid response labs and have all the things they need to make sure that they can care for patients. And the intriguing piece, everybody kind of thinks of this as a cost strategy, but really it's not. It's really a service strategy, because you can have a massive microbiology laboratory now with all the automation and MALDI, and you can be early adopters of that. And in the COVID crisis, you can stand up testing to the tune of multiple thousands per day, and deliver the turnaround times you need. And so we've been able to do that. Of course, we participate in other activities and outreach and physicians and all of those kinds of things. But really the benefit of the integrated model is to really drive benefit for the health systems that are part of us. And we continue to be an integrator. We're just wrapping up our last couple of hospitals. It's not an easy thing to do because we don't necessarily standardize IT platforms, so we have to do all the connection and building. And in this day and age, it's another thing that's become easier and easier to do. And one of the key areas that we integrate in is we have centralized all of our histology anatomic path work. So in a given day in our laboratory, we might be handling 2,500 blocks and generating 5,000 or 6,000 slides or so on a given night. And we've maintained kind of a truism to pathology services, is we want those slides read locally by the local pathologist, and they are the most valuable conduit we have to the clinician. So in our integration strategies, we did not want to disrupt that.
Yeah, absolutely. I think it's, we're first and foremost in the service business, I think, in laboratory medicine. And also, as you kind of alluded to, we do such a vast array of things. There's the clinical laboratory, of course, and then as well as the anatomic pathology lab, which are clearly very different, but often fall under the same organizational umbrella. And, we know that laboratory results play such an integral role in the treatment and management of patients. It's been said up to 80% of healthcare decisions are made, based on laboratory results, but only a small fraction of healthcare dollars actually flow into the laboratory. So I think that's great news, because we have a lot of opportunity to expand and increase our offerings and increase our value, which is fantastic. And then of course in business, I think clearly acquisitions and consolidation and centralization and getting these economies of scale is very important. But it's really that service and what's that value we can provide. So you said something interesting there, that it's not, you didn't necessarily see it as cost cutting, those kinds of activities, but a chance or an opportunity to offer the best service to your customers. So really, tell us what's your overall strategy or guiding mission at Alverno.
Well, I mean, from our values in the organization, it's really about providing care to patients and service to our physicians. And the other kind of unique piece besides those is a drive to innovate, to drive to be first. I will tell you that element of our mission can challenge us at times because we are often moving down paths that nobody else has really attempted. And our first experience with that, maybe not the first, but is centered around some of the work we did in the microbiology realm with automation. I think we were first or second in the country to adopt automation in microbiology. We were probably first or second to adopt things like MALDI technology, and you do those and you look at that innovation and you get a holy cow moment in that we took turnaround times from 48 hours down to 24 hours, and as you can imagine 24 hours sooner in therapy, huge significant impact. And and we believe digital pathology is another opportunity to do that. We are, part of our challenge is, as I mentioned, we generate, a massive amount of slides and work that we need to get back to a location. That location may be 200 miles away. And so you think about what has to happen operationally to make that occur, because that slide now has a demand for a turnaround time of 4 o'clock in the morning in order to make the run and get there. And then you're challenged because oftentimes it's not just the H&E, but there's some additional needs for special stains and those things. And literally it's almost impossible to get that slide back in time. And for us, we looked at digital pathology as the solution. It still creates some challenges because you still have to scan everything that you're generating on a given day, and you get your breath taken away a little bit when you identify the number of scanners you need to do that effectively. But it's not so much this notion that okay, we're going to save courier costs and all that, but we have now the ability to get a biopsy result back sooner, to get a special stain back sooner, to give that next day report for anybody that has been sitting by the phone waiting for the call of the biopsy they had. It goes, I think many moons ago people talked about sleepless nights. So, I mean, our hope is that we're helping to erase them as best we can, and staying true to that relationship that we want with the pathologist and the medical staff. We do not want to give that up, because others have argued, well, why don't you just put all the pathologists in a building, have everything read centrally, and just don't worry about the central lab folks can reach out. But I think there's you lose something in not having the medical staff connected with the pathologist, having them there and present to be. No doubt we have some hospital or a couple of hospitals that are very rural, very, very tiny, and perhaps in those cases we can't have a pathologist there every day, but at least some days, and we can then supplement with the remote reading. But but so far it's been enabling us to really continue to provide service in the way we think it should be provided.
This episode of Digital Pathology Today has been brought to you in part by DJT Solutions, your single source for all your digital pathology requirements, from consultation services to system requirements, including installation, training, and life cycle support. Since 1995, DJT Solutions, we are your best choice for your best results.
Right, absolutely. You said a lot there, and I think, Alverno's a trailblazer, so you're also now going to be a trailblazer in digital pathology, or have been, which is fantastic. And then you said, the importance of turnaround time. If we can alleviate by improving that, we can perhaps alleviate sleepless nights. And I think that's a hard thing for many of us to keep in mind in the lab space. We're always thinking, well, how can our test perform better? What's our sensitivity going to be? Is it, how are we going to get the best results? But if you ask a clinician what's important, right at the top of their list would probably be, how about a good turnaround time?
Seems to be.
Yeah.
Seems to be the number one in most cases. So.
And speaking of, you kind of touched on consolidation. And so what sticks out in my mind is we had a big wave of consolidation around in the early 2000s, where we had, and it seemed that the driving technology around that time was just FedEx, and we somehow discovered couriers, and we could really centralize labs, particularly in major metropolitan areas. You could develop a central laboratory for AP and then shuttle these slides, like you were saying, back and forth in a car in the back of a Honda Civic or something like that. I guess also maybe combined with the threat of decreased reimbursements in the AP space, it kind of drove a round of consolidation. So maybe, was that real, or am I just remembering it in a certain way? And then secondly, is there going to be a lot more room for consolidation, with the advent of digital pathology?
As we look down the road, I mean, we still see consolidation, integration as an opportunity. Always the caution is, you have to be doing this for the right reason. I think where it gets a little bit more complicated, in our world at Alverno, we have, different partners, different members, different organizations that make up the integrated model. So you have integration occurring, now very much at the overall healthcare facility level, and within that there is opportunity to do that among I guess the family, will call it. It's interesting whether third-party integrators will be driving it, or whether individual health systems, as they come together, will be trying to create those integrated models within their market. I mean, we still see the potential. I think the challenge that sometimes gets missed, is that, integration across all levels seems like it shouldn't be that hard to do. We'll bring a team of people together and we'll make it happen. Having been involved in these over the years, I assure you it's not easy, and it's not simple, and there are many, many, many dynamics that often get overlooked and can generate some really substantial pain points. And it's, you got to be willing to make the investments in technology, much like digital pathology, as just another element, another enabler. But the notion of this consolidation level, I don't think is quite done. I think it'll be interesting, particularly as we move through the pandemic, and organizations kind of start taking stock of the damage that has been done, and how they respond to it if it doesn't send off another wave of either consolidations, closures, and then kind of the other side of it, maybe not related to digital pathology right here, but There is some level of deconsolidation as now entities start looking at their kind of portfolio of organizations and start making decisions about this one's making money, this one's not making money. It really doesn't fit our model, our geography, or whatever it might be, and so you're seeing a little bit of the kind of the spin-off mindset in healthcare in general.
I see. So simple in theory, but definitely not easy. So I think what a lot of our listeners might be interested to learn from you, actually having gone through this process, because we're still at a low level relatively of full-scale adoption of digital pathology. We're still in the early stages, but as an innovator and actually having been through this journey, maybe tell us maybe a little bit specifically what that was like, starting from scratch and then implementing digital pathology. What did that look like?
Sure. I think we did a few things right, probably a few things wrong along the way. And so, if I go back to the beginning, and I think one of the things we did right was when we put together groups to start looking at this, we didn't take an administrative only look or a pathology only look. Our teams were built with both elements, and they worked lockstep. There was no question. So of course, we had the right team members because we needed willingness to travel and see solutions. And in our early days, most of the solutions didn't exist in the U.S. So we had pathologists, investing multiple days on really long flights to see technology and understand how it worked. We also made it very clear, our goal here wasn't to find ways to reduce pathologists, but to really enhance what we wanted to do. And we also, when we looked at it, how do I describe this? Is probably not the best administrative term, but we weren't looking to find the cheapest solution. We were looking for one that really would meet our needs, offered the flexibility, had a good track record of moving forward. Probably the biggest challenge of this, if I was to, put my short-term financial hat on, it is not the strongest of ROIs in the short run. And so we had to invest some time in where do we see this going? What is really the long term? And at some point we can, touch through, our thoughts on AI and how that might fit. But we really tried to at least have this as a long-term understanding. And then we made it an absolute strategic initiative with board sign-off. So I think we did a good job at aligning the organization. Part of the challenge is, and it's the pain of first, nobody had done this at this level. We're talking about bringing 8 or 10 scanners in and really, scanning in about 1.5 million slides. So, we really didn't have a very good understanding of just what kind of data we were really asking to do, and so we found ourselves scrambling a little bit in terms of there's no way we can store 1.5 million slides electronically, and so we had to back off on that and really say, okay, for the time being, glass has to be our long-term storage solution. So and then I think we still have, I don't know that we clearly understood how it might fit into tumor boards and some of all the other service considerations. So, we're working through them, and then probably it's just there's a joke internally about the physical environment for scanners in terms of temperature and humidity. Is just a key thing to be aware of.
I see.
So we had some challenges in that realm, and we got through them.
So certainly it's not going to happen overnight. You're not going to flip a switch and then, you come in Monday morning and you're going to be digital, right? It's a journey, and there's going to be a period where, the glass and the digital coexist, which, it might probably still be going on. I'm guessing that, you haven't completely phased out glass.
Yeah, it is. We are moving through it. I mean, part of the challenge is we had 30 sites to transition to digital, and we started the transition, I want to say, in 2019, and it was supposed to carry through the first part of 2020, and then some little virus came in and kind of really disrupted things, and because there's a little bit of training and sign off you have to do locally, and pretty hard to do when we're banning anybody going into any of our facilities, and then just resources constrained because of that. But it we are well on that journey, and I think our target right now, given the delays, is we will have the entire system digital by the end of 2021.
Okay, well, that's fantastic. So you said, one of the challenges of being an early adopter is you didn't really have anyone to look towards, for case studies and inspiration and know-how. So it seems like Europe might be a little bit ahead of us in the game so far. So it sounds like you were traveling to Europe and, some of the, Philips, I believe it's the system you went with. Not so we're not here to endorse Philips, but it'd be interesting to hear kind of your thought process and kind of what went into the decision to go with that system, and and what were your non-negotiables, or what were your must-haves right out of the gate.
Yeah, we are using Philips. At the time, they did have the advantage of being the FDA approved unit. So that's, was obviously extremely important, and I wouldn't dismiss costs and all those, budgetary things, but it's how Alverno chooses partners. We have never been the lowest, looking for the lowest cost. We try to understand who we're working with and what is their strategic direction over a fair number of years. And so that is probably the most critical piece. While we may not have everything in our mind perfectly, diagrammed, we generally have at least a 3-year kind of sense of where we're going, if not longer. And so we're looking for alignment from a strategic perspective. It's what are you going to do with the technology? Okay, great. You can scan a slide, and we can, beam that slide in kind of Star Trek terms to wherever. You can get it through the firewalls and manage all the IT constraints and all of that. But what else? What else is there? So what else are you bringing to the table? What are you working on? Who are your other partners? What are your thoughts on AI? And so that for us is an extremely important dialogue. I want to be clear. I mean, let's not be naive. Money does come into play, but it doesn't carry any more or less weight than anything else. And there have been probably cases where we've identified a strategic path and couldn't find a partner that was aligning with what we wanted to accomplish, and so sometimes we just drop those altogether. But being first is the team at Alverno has kind of accepted that risk and the pain. So we know that we sometimes are creating it, and we accept that if we're in that role, we're going to get it wrong sometimes. Yeah, but generally there's, it's all fixable, and we can continue to move forward. So Philips has been a good partner, and they've been kind of true to their, strategic path, at least in our eyes.
Yeah. Okay. Yeah, that's great. So it's not necessarily a one-off transaction, and you're not just buying a piece of equipment, right? Especially, with a system or a network as large as yours, right? You're really entering into a partnership, a journey together, and not only solving the problem now, but where's this headed in the next couple of years?
Yeah, I mean, we have to be. We're doing new stuff, and so yeah, we have a sense of today, but we want to also be in this situation where there's probably many things we haven't thought of. We don't claim or pretend to be the absolute brightest in the world and know everything. We're interested in partners that we can learn from and help guide us along the way. And that's kind of what the partnership is. We're going to be together for a long time with this technology. And so, setting up a transactional relationship is not particularly appealing.
Right. And I think that's where many people actually get excited, right? We get all the pieces in place to go digital, to scan our slides, to review all our cases on a computer monitor. But then what? Then we can build on that. And you're kind of alluding to, then we're going to add offerings above and beyond that. AI is such a hot topic now. And I know you have a precision medicine program at Alverno. And I think, so the question is, how is digital pathology going to facilitate precision medicine? Because I think another thing you talk to is getting the right result to the right patient at the right time in the right place to guide the right therapy, right? So what's that going to look like? And how is digital pathology going to promote that?
Yeah, I think it has the hope of providing a way to take not necessarily disparate, but isolated sets of data, and if we can somehow bring that into a more complete picture, which includes the surgical pathology in that, along with then the sequencing, to really bring an entire kind of picture to our oncologists or our care teams. We think there's some power in that. And so, I mean, right now it's as simple as, getting it all together for, a tumor board meeting. But I think it has some potential beyond that. And I would probably tell you that we probably don't have it clearly defined in our mind, but we know it's there. So we're really looking forward to kind of bringing, at least from a more integrated perspective, in understanding what it means. And then I think there's some minor benefits when you start looking at a piece of glass and you're or a tissue on a slide. You're going to want to find the areas of cancer, so that potentially, if you're looking for where to section in the block, or if you're going to micro dissect off the slide those cells, and use them in a precision medicine study, I think it gives you a much finer kind of pinpoint to bring that together. And I will tell you, I mean, we're very early on in our precision medicine program, and once again, it's like COVID has kind of derailed us a little bit, so we're still building that program and bringing all the links together to make it happen. So we have a way to go and truly maximizing the relationship between the two technologies. So, but I think exciting, and we'll eventually get there.
Yeah, absolutely. Exciting times indeed. Well, Sam Terese from Alverno, thank you so much for being with us. And before we wrap up, just maybe tell us what excites you. Where do you see the field headed in the next 10 years or so?
Oh, yeah, that's such a difficult question. I don't know whether to ask from a digital pathology perspective, a precision medicine, or just laboratory in general. If I kind of step back, and I was in a dialogue earlier, for the first time, probably, laboratory has been front and center to the world as we've battled the pandemic. We've been recognized, and we've gotten the good and the bad, and there's the negatives and all that, but it really is out there in presence. I think digital pathology kind of opens up this area of AI in terms of how it fits and how we can potentially use it beyond just the operational efficiencies of RPA and the like. So I think we're in this really golden moment where we have the attention of the world, and I guess my hope and my prayer is we don't let it slip away, that we don't drive ourselves back into our typical boxes, and I hope leaders out there kind of challenge the borders, and it can be in all sorts of different ways. I mean, our phlebotomists now are our primary collectors for COVID. It can be in many ways. So I think it's really an exciting time, but I don't know, if you would have asked me the question 10 years ago, I would have said it was an exciting time. So, I think it's I think there's going to be more and different technologies and greater opportunity to be there and be present with patients and the like. And I see staff, they're so excited because the work they do with COVID, for example, they realize just how much of a difference it's making. So I think, technology is going to continue to explode. I think we're going to see more digital, more AI. I think we're going to see more, near patient things. It's just really an excitement, and that my hope is that we all don't just go back to how we did it before and lose the opportunity. So
Yeah, I like that. A golden moment. Let's not let it slip away.
yeah, yep,
All right.
don't happen that often.
Yeah. Well, our guest has been Sam Terese from Alverno. We'll see you next time on Digital Pathology Today.
This has been Digital Pathology Today. Please be sure to subscribe. Thanks for listening.